Hello guys, so now we shall be discussing about another infection caused by human herpes virus, that would be Roseola Infantum. Okay, so now we shall be discussing about the most important points on Roseola Infantum. Roseola Infantum. Now, coming to this Roseola Infantum, what is the most common cause of this Roseola Infantum? It is caused by human herpes virus 6. It is caused by HHV-6, and human herpes virus 6 is also the most common cause of febrile seizures. Okay, so most common cause of febrile seizures is also human herpes virus 6. Now another important thing is that which age group does this most commonly affect? It will affect less than 2 years of age, children of less than 2 years of age. Now in these patients of Roseola Infantum, in the first 3 to 5 days there will be high fever. Okay, so in the first 3 to 5 days, there will be acute onset of fever. And this acute onset of fever is then followed by what? A maculopapular rash. So first there will be acute onset of fever, then the patient will have maculopapular rash. Okay, then the patient would have maculopapular rash. Now when it comes to the differential diagnosis, you might be confused because maculopapular rash is also seen in rubella, it is also seen in measles as well. Okay, so how do you differentiate? For example, in case of rubella and in case of measles, where does the rash start, guys? So obviously there will be a maculopapular rash, there will be maculopapular rash. Okay, in case of rubella as well as in case of measles, there will be maculopapular rash, but this maculopapular rash first starts on the face and then it spreads to the trunk as well as extremities. Okay, so first this maculopapular rash starts from the face, okay, and from the face it would spread down to the extremities. Not only extremities, this rash will also spread down all the way to the trunk region and also to the legs. Okay, so this rash is also distributed in the trunk. So where does this rash first start? It would start in the face and then it would spread down centrifugally to extremities as well as trunk. But exactly the opposite of this will be Roseola Infantum. Okay, so in Roseola Infantum, how does the rash spread? First the rash starts from the trunk and then goes to the face and the extremities. So first rash starts in the trunk and from the trunk it will go to the face and the extremities. So this is a differential diagnosis which you have to know, right? In both of them you will get the maculopapular rash. So even here also there is maculopapular rash, but this maculopapular rash starts in the trunk. Whereas in case of rubella and measles, it will start in the face. Okay, it would start in the face and then go to the extremities. And obviously the third differential diagnosis, first will be rubella, measles, then Roseola Infantum rash. I told you. You also will find rash in case of another disease that is called as erythema. Erythema infectiosum. I have already discussed this about erythema infectiosum. Right? I have already discussed about erythema infectiosum, telling you that erythema infectiosum is also called as the fifth disease, right? Fifth day disease. And here the rash will not spread anywhere, rather it is only in the face region. That is also called a slapped cheek appearance. That would be slapped cheek rash, slapped cheek rash or slapped cheek appearance, right? So this is all you need to know regarding what? Regarding the Roseola Infantum. Thank you so much for watching my video. Goodbye.